Imagine a new medication for hypertension that shows a perfect 10-point drop in blood pressure during a highly controlled study in a specialized hospital. But when that same medication is distributed in a busy community clinic in rural Nepal, the results are disappointing. Why the discrepancy? This brings us to a fundamental distinction in epidemiology, the difference between explanatory and pragmatic trial aims. Before we dive in, ask yourself, if you were a public health official, would you care more about how a drug works in a lab or how it works in your community? By the end of this lecture, you will be able to do three things. First, you'll define the specific aims of explanatory and pragmatic trials. Second, you will differentiate between these two approaches across key features like participant selection and study setting. And finally, you will learn how to evaluate which design is most appropriate for a given public health research question. In epidemiology, we often talk about the bridge between research and practice. Explanatory trials focus on efficacy, the performance of an intervention under ideal, highly controlled conditions. Pragmatic trials, on the other hand, focus on effectiveness, how well that intervention performs in the real world of routine clinical practice. Understanding where a study sits on this spectrum is critical for causal inference and, ultimately, for making sound public health decisions. Let's start with explanatory trials. The core question here is, can this intervention work under ideal circumstances? To answer this, researchers try to remove as much noise as possible. They use strict inclusion and exclusion criteria to ensure a homogeneous group of participants, usually those who are most likely to respond and have no other health complications. The setting is often a specialized research center with highly trained staff and near-perfect adherence. The intuition here is purity. We want to isolate the biological effect of the treatment itself. For example, in an explanatory hypertension trial, we might only include adults with no other diseases who promise to take every single pill at exactly 8 a.m. This tells us the maximum potential of the drug. Now contrast that with a pragmatic trial. Here the question shifts to, does this intervention work in the real world? Instead of a specialized lab, the trial takes place in routine clinical settings, like a community health post in South Asia. Participants are heterogeneous. They might have diabetes, they might be older, or they might struggle to travel to the clinic. The intervention is delivered just as it would be in normal practice, and we measure outcomes that matter to policymakers, like overall community health. The interpretation shifts from biological efficacy to public health impact. Think about this. If we test a salt reduction program in a village, we don't control what every person eats. We just see if the program actually lowers the village's average blood pressure despite the chaos of real life. These two designs sound similar, but they are not the same. Let's look at the key differences. In an explanatory trial, participants are highly selected. In pragmatic trials, they represent the general patient population. The setting for explanatory is specialized. For pragmatic, it's routine care. Explanatory trials require strict adherence to a fixed protocol, while pragmatic trials allow for the flexibility seen in real-world practice. Finally, explanatory trials often use per-protocol analysis to see what happens when the drug is taken correctly, while pragmatic trials use intention-to-treat analysis to capture the reality of missed doses and dropouts. A common mistake is to think one is better than the other. In reality, they serve different purposes at different stages of research. So, when is this useful? If you are a researcher developing a new vaccine, you might start with an explanatory trial to prove it actually works biologically. But once you want to know if a national rollout in India or Pakistan will actually save lives, you need a pragmatic trial. When you read a research paper, always ask, who were the participants? And is this setting comparable to my own community? If the trial was too explanatory, the results might not apply to your patients in a resource-limited setting. If you remember only 3 things from this lecture, remember these. Explanatory trials test efficacy in ideal conditions. Pragmatic trials test effectiveness in real-world settings. And the choice between them depends entirely on whether your goal is to understand a mechanism or to guide a policy. Before we finish, let's test your understanding. First, if a study aims to determine the biological potential of a drug by only analyzing participants who completed the full treatment, Is that aim more explanatory or pragmatic? Second, you are designing a study to see if a mobile health app reduces blood pressure among tea garden workers in Bangladesh. Should your inclusion criteria be strict or broad to make this a pragmatic trial? Think about it. The answers lie in the balance between control and reality. Thank you for joining this lecture on trial objectives.